Assalamu alaikum, the communication day. First scenario, Miss Margaret Mountford, 30 years old female, was admitted to the hospital following a seizure. An MRI and was performed and reported as normal. An EEG showed seizure-like activity but was consistent with non-epileptic seizure. Video telemetry conducted by the neurology team confirmed that this is not epilepsy. The neurology consultant has reviewed the case and confirmed that this is an epileptic seizure and patient can be discharged. Your task is to go and discuss functional neurological disorder FND with the patient and address her concerns. Are you ready, Dr. Maida?
Yes.
Yeah, okay. You can start. Here you go.
Hello, my name is Dr. Maida, one of the medical doctors. Just can I confirm that you are Miss Margaret Mountford, 30 years old?
Yes, doctor.
What do you want me to call you?
Margaret is okay, doctor.
Okay. Okay, Miss Margaret, we are here to discuss the results of investigation we have been done. First, can you tell me how you feel at the moment?
I just have a mixed feeling anyway. I'm scared if I'm going to have another fit. I'm just kind of scared. All the same, I'm still okay. I'm better now.
Mm-hmm. Yeah, understandable. Do you want anyone to attend this discussion with us?
No, I'm no.
Okay.
I'm okay, Lord.
Okay. Just can I ask you, do you have any concerns or any expectation about what might be causing these fits?
Doctor, I'm not. I'm just scared because I was kind of embarrassed when I first had the fits, and I'm scared if I'm going to have another one again. And I'm also scared if it's going to be what my children can end up having. This, I'm just scared, doctor. And
yeah, understandable. Okay, would it be okay if I explain the result of the test and what they suggest about your fits?
Okay, yeah, because I've been itching to know what's the diagnosis. I'm itching to know about my what the doctor has found out in the investigation they did.
Yeah. So we did some investigation. This investigation including the tracing of your brain, what we call an EEG, and also we did some videos and to see what this type of fits, what we call in medical terms seizures, to find out what's going on. So it's for us, these results were come clear, and it doesn't show that there is electrical firing up of your brain. So the investigation showed that it's normal. I mean, there is no electrical firing of your brain causing this problem. And what we are looking for, what we call in medicine, is epilepsy. So your brain is not showing sign of this electrical disturbance showing in the epilepsy. But we know that your fits are real. It's not imagination, but they are caused by the brain function, and your brain is functioning in different way, not by electrical misfiring. Are you follow me?
Doctor, I understand what you are trying to say. Yeah, means I don't have epilepsy. Is that what you are trying to say, doctor?
Yeah.
Okay.
So you didn't have epilepsy, but it's still you have this. We know that still you have these fits, and as your brain, at the investigation that it doesn't show that you have a problem with the electricity of your brain. We call this functional seizure, or your fits called functional seizures. Do you ever heard about this term ever?
No, doctor, I don't understand what that means.
Okay, so this is a common type of seizure. To be honest, we have a little understanding about it at the moment, but what we believe that this episode are linked to how the brain responds to stress or past trauma or any emotional challenges in your life, even if you are not aware about it. How this sounded to you?
Yeah, it sounds okay. No, that can really explain because this period I've really been stressful, doctor. I've really been stressful from work to school, from school to work, back to maybe that might be the reason, doctor. Yeah, because I've really been stressed with this period, and
Okay,
I
so
think that
you think that you've been stressed. Can you tell me exactly what is stressing you? You told me you are stressed at work. What type of work you are doing? What do you do?
Doctor, sorry interrupt. Dr. Henry, please, if you can make your sounds little bit clear and loudly. Okay?
okay.
Yeah.
Okay,
Thank
sorry.
you.
All right,
Thank you.
all right. Like I said, I work two jobs.
Oh,
I worked with the warehouse in a warehouse. Sorry, and
mm-hmm,
also I also do some part-time job too as a support worker.
mm-hmm,
And also couple the fact that I school. I'm doing my master's degree to one
mm-hmm,
of the universities. So and then I'm also a a wife at home.
mm-hmm.
So the work and the studies has been affecting me so bad, doctor.
Yeah, yeah, I can understand that. So this is a lot of difficulties and a lot of
Yes.
stress in your life. And
Yes.
we think that this is type of fits you had most probably caused by the type of stress. And in this condition, the only thing that do you think that you need a help in handling this situation?
Mm,
Doesn't sound to
Doctor,
me.
yes, I got a visa, from a support work here in the United Kingdom, and I got my family. I'm more like the main person. My husband is a dependent, and my 2-year-old son that is there. So if I don't work,
Mm,
my family we suffer.
mm,
So I have to do two jobs with my main job. And also I came with masters too. You can
mm,
see I'm stressed, and if I don't work, I'll not pay my
mm,
bills, and my son will not be able to get all the good requirement that he needs.
mhm, mhm.
I'm kind of I don't know, doctor. I don't know.
Yeah, yeah, I
Mm.
can understand you're facing a lot of things and you have a lot of pressure. Do anyone help you? Do you try to tell me that you are facing issues uh, regarding your son as well? I
Um,
mean, hand
yeah, my
handling.
son, because sometimes like I have to take him to the minders when I'm going to work, and I pay for it too. So I pay for his services too. Except when my husband is at home, he doesn't work, and then he kind of help me in some other things. But we need to pay our bills. We need to pay our utility bills. We need to pay our electricity bill. We need to pay our rent. So we need to work. I'm
Mm-mm,
working. My
mm,
husband is working, and but yet the money is not
enough.
enough.
Okay.
2 minutes left.
Do you ever check that I can refer you to social support service? This is can help in this regard, and they can help you through your financial issues. And I can. You can contact the social department as well, so they can help in these issues. And I also can help that by referring you to a psychiatrist. I mean, the psychological team. So they are good listener. They will listen to you. I think you have burning over and to handle all these things. And I know you as newcomer to the country, you will face a lot of things at the moment. So I think it's very helpful if you also decide with the mental health team. They will help you to handle this part of your life more good, and this will help your symptoms as well. How this sound to you?
Yeah, it sounds. I think that sounds encouraging, doctor. That
Okay.
sounds encouraging. Mm.
At the moment, just I want to ask you some questions and regarding your social life. Um, that's okay.
Okay, doctor.
Okay. So, can you tell me, do you smoke?
Doctor, I don't smoke. No.
That's
Mm.
good. I encourage you that to do so. I think you are in very in very difficult time of your life. And what about alcohol?
No, I don't take alcohol,
Mm-hmm.
but I take a lot of coffee. I don't do it because of I have to wake at night to do some
Mm-hmm.
jobs in the warehouse where I take a lot of coffee. A
Oh,
lot of that to keep myself.
yeah, I think this is very important thing that you because sleeping is very important in this type of seizures. I mean, these fits you have. So when you are deprived from sleep, this is can increase the symptoms. And I hope that if you decrease the amount of coffee, so you give your mind a peace to switch off, just to make sure that you are sleeping well and you can then manage your life. It does sound good.
Doctor, it will be difficult, but I will see what I can do, doctor. I will see what I can do.
Yeah, so with the help, I think with the help of mental health team, they will help you to find a way to reset your mind. I mean, to switch off your mind for a little and have a good sleep. And also the social workers will help you in these financial issues. And I think this can help your symptoms as well. How this sound to you?
Well, it sounds great, doctor. It sounds great.
Do you have any other concern you want to say?
And another concern, doctor, like I said, am I going to have this fit again? That's my problem.
Mm-hmm. Um, at the moment, I will not be sure. I'm not sure that you will have this. Most probably, if the all this condition continue the same, you may have them again. And because this fits is still, you have this fits. I think you need to. Are you driving?
Yes, doctor. I have to drive for me to meet up with my jobs and domestic activities.
Uh, I think you need to contact at the moment if you stop driving and connect to the your driving license, um,
You mean the DVLA?
DVLA. So they will assess and help. They have roles at the moment. I am not recalling the roles of the DVLA, but you need to contact them. So you need to know about this diagnosis if it is restricted. But for my side, as it is a real fit, it's still you need to stop driving at the moment. How this sound to you?
Okay, doctor. I have to contact them. My health first.
Yeah.
No problem.
Yeah. Okay.
No problem, doctor.
Yeah.
Mm. Uh,
We
uh,
added 2 minutes for
uh,
the concern. Any concern,
okay.
Dr. Henry, you want to add?
Um. Well, since but like I said, am I going home anytime soon? Because I'm not ready to go home, doctor. I want to stay for a while.
Okay,
Um,
I answered this concern, the last one, Dr. Maida.
You to stay in the hospital. I think staying in the hospital is not in the best of interest of your condition, as far as because staying in the hospital also there is a bad effect of that you may catch a bug and you may be more ill. and this is not in your best of interest. And at the moment, as we reach the diagnosis, and we have a diagnosis and we have a plan for your management, I believe that it's a good idea if you can go discharge from the hospital at the moment, and you can come as outpatient. We still follow you as outpatient in our neurology clinic, the brain doctor clinic.
Doctor, I need time to rest from domestic activity and my work. As I'm here, I think my two jobs are paying me as I'm in the hospital, and
Mm,
I'm not doing some domestic work. That's why if I return back home immediately, I will have another seizure because I have time. I needed time to rest and then plan my life again, so I can
mm,
leave one job and just sustain
yeah.
myself with just one job. That's why I needed to stay for a while to have
Mm,
time to plan, doctor.
mm.
I don't want to come back here again with another fit.
Mm-hmm. Completely understandable. But still, you can have time of your work. We can provide you by a sick leave, and it's still you can be paid from your company, and
Wow.
you can take this
That's
rest
good.
time at home.
Yes,
Okay,
perfect.
okay,
Yes.
okay.
Yeah.
All right. Thank you, doctor. I'm happy with this. There's no
Yeah.
problem. All right.
Okay. Thank you, Dr. Yanari. Well done, Dr. Maida, as usual. You are now professional in communication. You know how to convince any patient. I think the concern, all of them, was answered correct by Dr. Maida. Any opinion, Dr. Henry? You can comment now, and then I
Yes.
comment.
My is she's lucky. She's missing a good stimulator or a good because she didn't talk about discharge all through her comment. I was one that mentioned a discharge. In one of because she didn't mention that she want to discharge me. And in the case here, it was stated that discuss the discharge. And this just say that the knowledge consultant has reviewed the case and confirmed that this is a non-epileptic seizure and patient can be discharged. But she didn't mention about her discharge, about her
Mm,
discharging me. She didn't mention
mm,
it. So it was towards the end of the scenario. I now felt
Yeah,
that because it was part of my concern that I don't want
mm,
to go home. But she
yeah,
didn't mention it. I just felt that let me just give her that mark, that score. If not, she would have lost score in terms of
yeah, yeah,
my last concern because she didn't mention anything about discharge. Ab initio, but she has been doing very well. She started in a very good, calling somebody to come and if I need a a partner, somebody that will come for the meeting and everything, which was good. And then she started by asking my concern, which is, which although it was early, but it was also good because it gave her a leeway for her to really address the concern. But by and large, and the description that she gave for the FND is okay. Yeah, lovely. And coupled with the fact that I also volunteered the history of distress, you know, for her. That also helped kind of give her the uh, opportunity to go forward. If not, it's okay. It's okay. But like she did very well.
yeah.
Thank you.
Yeah,
Thank
thank
you.
you, Dr. Henry. I agree,
Mm,
she did well.
mm,
By the way, any scenario with functional disorder, either the surrogate will be volunteered to tell you about his or her stresses, or at least you have to explore his stresses in the life.
mm,
One of them, the financial, for example, supports the overloads, overwhelmed work, two jobs, a house wife, working as another job in the daytime, plus the homework. So you have to address all these things. Adding to them, of course, you have to address the sleep. Is she sleeping well, adequately? Anything from external factors that lead to the stress, like in this scenario, caffeine. I think caffeine as well is one of the CNS stimulants, so he should reduce the amount or make it once a day. Plus, it make him more sleepy or make her more awake and less sleepy, as Dr. Maida mentioned. So it's by two ways, either direct way and indirect way through the sleep. The next thing, of course, the smoking alcohol is supposed to be also addressed. The driving at the end, Dr. Maida, remember. But please try to remember it earlier because the time was up. I think also the discussion Dr. Henry was explaining about his condition and he take time. But always in the exam, the surrogate will be instructed to give certain concerns but he will give you chance also to address them. Okay, so please, the one will be surrogate, give time to the candidate to address the concern. I mean, give
Okay.
him the concern, yeah, shortly, and let her address. Other concern, you want to give another concern, give it shortly. So let her a chance to express, because we know that we have to listen to the surrogate, but we have to address the concern as well. Okay. So I hope this understood,
Yeah.
Dr. Henry. You
Yes.
understood
Yes.
this, okay? As well for Dr. Maida, anyone will give a concern, he try to deliver the concern shortly. So I have two jobs in my life. That's it. Let her address it. We want more concerns from the surrogate, because in the exam there are some concerns will be instructed by the examiner, for example, three or four. Otherwise, the candidate should explore the other concern, or he should do the task. And in this scenario, I agree, she should talk about the discharge. She didn't mention it unless you explore it to her or you raise it. I want to stay at hospital, but against the medical advice, no, we should discharge you. You can offer also Dr. Maida someone to drive her home, because she's not allowed to drive anymore, right? And if she
Yeah,
asks,
this is like my concern. It's functional. Is
yeah, yeah, there is stop
still
driving.
stop driving.
Yes, it's a seizure, right? So it might happen while driving, whatever. It's triggered by stress. Soon, in fact, it's still seizure. So you cannot tell him or you cannot allow him to drive. You mention it, it's a seizure. Okay. Uh, then the other things, yeah, discharge. No need to stay at hospital. Even you can tell her the staying at hospital put a lot of pressure on you, because you are away from your family. Nothing will be offered to you. So, and the decision was made after reviewing all investigation. You don't have anything need to be treated as hospital. So not a matter only of catching infection. Okay, you got it.
Mm.
Okay, otherwise you did well. Really, it was amazing session from you, or an amazing performance. I think you will not be minus from any of your skills, apart from the discharge as a plan. If you have time, of course, you can offer the leaflet brochure about functional disorder. You can give her alarming sign. Don't forget to give her some warning. It's not to be swimming alone, not to lock the doors. Okay, don't, not to have her hobbies in the coming days unless she's free of these seizures. Of course, after contacting the mood doctor and controlling of her triggers about the stress. Okay, if she solved the issue of the financial issue or the other support that she need, and she's fine, of course the seizure will be fine, and she will not be having a seizure anymore. Anyway, you have the idea how to address the whole scenario concerns. Functional disorder, by the way, it's one of the new format style that it appeared recently, maybe the last year only. So functional disorder as seizure, as well as for irritable bowel syndrome, tension headache. Sometimes also they brought, I think, multiple sclerosis as functional. So the same
Mm.
concept, you can talk about the stressful like life condition, how to address. And if the patient is having a lot of work, let her take a vacation. Think about vacation. Are you thinking to get a vacation to relieve your brain, your stresses from the work, like this? Okay. Some mentors
Mm.
also mention you can do yoga for relaxing time. Anything that can relieve the patient from his stress or her stresses, she can or he can do it, and hopefully the seizure will not appear again. Okay.
Mm.
You have any question, Dr. Maida?
No, thank you. Yeah, I think yes, I need to explain that.
Yeah. Okay.
Mm.
Any question, Dr. Henry? Any comment?
Um. Yeah. She did well. So she did well.
Okay. Thank you. Dr. Maida, can you post your scenario for Dr. Henry?
Yeah, just a minute.
Yes, I read good comment here. Zoom. What is the management plan, or what is the plan of management? So it's something I think she didn't mention directly, but
Uh,
she said she should control her stresses. Yes, I understand what she want to say. This question, she want to say that you have to refer for more doctor or the social support, but you touch all the things by addressing the stressful condition. You got it? So she might have sitting with talk therapy with a mood doctor, for example, if she has a social or sorry psychological issue, but not in this scenario. She has just load of work. So social support or social worker will be the most important team to be involved, as well as occupational worker, if they can help her while reallocating her in another job, that having less effort or less load on her, plus arranging social issue with her husband, for example, if he can have another job, or they can help them financially. I don't think this is an option. So they cannot say we will support her financially because her husband is staying at home. No, I think they can offer her husband a job to help her to provide the support financially to the house. This is my opinion. Okay, but no, of course, no pharmacological option here. It's nothing to be offered, nothing to be done apart from the follow up. Yes, we will follow up you if you have this seizure in different way. Please don't hesitate to call us. It might be epileptic one, because you don't know what will happen in the future. However, what you have now is not epilepsy. But if you have a change in the nature of the seizure, please contact us. Okay, clear? Anyone has comment, want to comment? Dr. Rabia, are you with us? You want to comment about neurological point of view in this scenario?
Yes, Dr. Basim, I am here. No, you are very clear. I just want to ask you, Dr. Basim, it's my own concern. A patient who's having a functional neurological deficit and he came with some non-epileptic seizure, how can EEG will show you some seizure activity without a non-epileptic seizure? I'm not sure where this scenario
Yeah,
is
I
taken.
think this is wrong. Yes, I think.
So this is completely wrong because
Yeah.
the differentiation between a non-epileptic and epileptic seizure is the EG. EG should be negative to make sure it's not an
Yes.
epileptic seizure, right? I wanted to ask you if it's a functional neurological disorder, do we need to tell him all this? That he cannot drive, he need to avoid caffeine, he need to avoid I mean to say sleep well. I mean to say you are going to give him all the information the same as a seizure. However, it's a functional and logical deficit, but still you are going to give him all this uh, like we give it to a real Caesar. Are we going to give him the same
Yeah,
information?
yeah, it's in real, it's seizure, right? So it happened.
Do you mean to say it was a real Caesar, or it was just some uncontrolled activity which was not a Caesar?
Yes, it's
I,
not
I,
it's not epileptic one, but it's functional, but it happened as fits, right?
okay, all right,
So
okay,
you have to advise her about the precaution and how
mm-hmm.
to avoid the triggers and why
Okay,
it happened. You should give her more information how to avoid it.
right, okay,
Okay,
that's
but
there,
at the
right,
end, it's fits, or if you don't want to say this is seizure, but it's abnormal movement or shakiness that
okay,
it
okay,
mimic the epileptic one, but
okay,
in fact, it's not appear in the EEG.
right. So it's not epilepsy, but it could be a Caesar
Yeah.
due to functional logical deficit. All
Yes,
right,
exactly. Yeah.
okay, clear, right.
Thank you, Dr. Abi. Thank you. Someone wrote cognitive behavior therapy. Yes, agree. Any of the psychotherapy or psychological support, social support, this patient need only support. That's why I like the Dr. Maida when she offer firstly, do you think that you need any kind of support? Yes, this is the best way to address this concern or this scenario, the support. So it's not something to be managed pharmacologically or need to be given option of surgery or whatsoever. So it's just support and talk therapy, for example, or address the main trigger, how to solve it, any support missing or defecting at her life, you have to treat or you have to control it. Okay, Dr. Send the scenario, Dr. Basim. Okay. What about driving in this case? Yes, again, as any fits, you have to avoid driving because it might happen while driving. Again, it's functional, but it's again shaking or abnormal movement that it might harm his life while driving. Need to inform the DVLA. Yes, there is of course the I think there is parameter for the functional disorder, the epileptic one, for how long should be free that she can resume her driving. I'm not sure about the duration, by the way. That's why I cannot say for a couple of weeks or couple of months. But I remember he should or she should inform the DVLA. As long as there is seizure or epileptic, not epileptic, fits, so or abnormal movement, she shouldn't drive. Dr. Maida, can you send the scenario for Dr. Henry?
Yes, I'm trying to, because it's a list of scenarios. I'm trying to
Oh,
just
okay, no
take it
problem.
out.
I thought you sent it to the WhatsApp. Just tell me whenever you're done, okay? Explore the reason why the patient doesn't want to be discharged. Dr. Alauddin Mitwalli. Yes, absolutely right. If the patient insisting to stay after giving the decision firstly, so okay, you can offer him that the decision made by the consultant, you have to be discharged or you can be discharged. Don't say you have. So, okay, so you can be discharged home. No, doctor, I want to stay. Now you can address. If he or she is convinced with the first opinion that she can be discharged, you can now you can address why she want or he wants to be at hospital. He will tell you, for example, I'm worried of my work. Okay, we can give you a sick leave, as in this scenario. I think Dr. Maida addressed this issue properly. Why you want to stay? I want to be away from my work. Okay, we can offer you sick leave to be calm. After you be calm, relaxed, and you are fit to be resumed your job, you can resume your job. Otherwise, it's not the way to stay away from your work. You cannot keep the patient in the hospital in order to help him stay away from his work. No, he can go home and you can give him the sick leave according to your neurological decision or consultant decision. Is it clear? Okay, what the driving we already address. Thank you. Cognitive behavior. Oh yeah, I think we cover all comments. Anyone want to add any comment? Please feel free to say it, not only to write.
I sent in the WhatsApp.
WhatsApp. Okay. And the Pro. Yes, I can see now. Are you sure this is communication?
This is the issue. That's it. It comes very long.
Okay.
But
By the way, by the way, they will not give you summary in the exam. You have long scenario like this, and you will read it many times with the stress. You might be unable to understand what they want from you because they wrote a lot. So be ready to be handling such long scenario, particularly in the training. Even in the chat box, I cannot post because it's very long. I will post it in another. Wait, stop parts. Okay, let's read the scenario. You are the medical registrar in the respiratory team. Mr. Imran Ahmed, 68 years old, has been recently diagnosed with metastatic lung cancer. He was referred to the same day emergency care clinic by his GP due to a chronic cough. A chest x ray done in the clinic showed a suspicious of lung mass, but unfortunately, the imaging wasn't reviewed by a senior clinician at that time. The patient was sent home without urgent follow up. A few weeks later, he represented with worsening symptoms. Further imaging and biopsy confirmed the diagnosis of metastatic lung cancer. You are now speaking to his son, Mr. Ahmed, who has requested a meeting to understand what's happening with his father. He is concerned about delays in the diagnosis and wants to know what to expect moving forward. Your task, I think the task is still, explain the diagnosis and current condition of Mr. Imran Ahmed, address the concern about delay in the diagnosis and knowledge and shortcomings in care, discuss next steps, including treatment option, involvement of the palliative care team, if appropriate, handle the conversation with the son. I don't think the time will be enough to address all this concern. So, Dr. Henry, good luck. When you're ready, let me know.
Okay.
At least cover the most important points in this scenario. Of course, you cannot cover all of them.
Even the treatment, I think, no need at the moment.
Yeah, I think so. So it will be in another meeting. Anyway, let's see how Dr. Henry will. Let me know when you are ready, Dr. Henry.
Okay. All right. Ready?
Ready?
Yes.
Yeah, here you go. Try, please, your sound to be more clear, okay?
Okay.
Yes, here you go.
Good morning. I'm Dr. Henry, one of the medical registrars attending to the patient here. I understand, may I confirm, sorry, if you are your name and age, sorry?
My name is Ahmed.
Okay.
I'm 30 years old.
Okay. May I confirm, are you the son of one of our patients, Mr. Imran Ahmad?
Yep, yeah.
Oh, okay.
My father.
Yeah, it's my pleasure seeing you. Do you mind somebody else to join us with this meeting, or you want to discuss the meeting personally with me?
It's a really depressing meeting, I think. So I don't want anyone to attend this.
Oh, I'm so sorry to hear that. All right. May I ask, sorry, if you have the lasting power of attorney of your dad?
I'm next of
Okay.
kin.
Okay. And I don't know if he has given you the consent to have the discussion with me.
Yes, he
Okay.
knows about it. Yeah, he knows.
Okay. Lovely. All right. May I please know what you know about his condition first of all, going forward?
Yeah, doctor, I know that he has cancer in his lung. And what I know what depressing me a lot that he had come to the clinic few months back. I think we come last 4 months ago, and the doctor he requests for us an X-ray, and the X-ray. I don't know why you didn't see that cancer on that X-ray. And now he has this meds.
I understand this will be very difficult for you to right now to really bear the information concerning your dad's condition. I want to assure you that uh, what has happened is kind of is an error on our parts. One of our colleagues have fully performed this. He saw the image or the photo results of your dad, but probably did not pay attention to to the the nitty-gritty of the image, and he couldn't notice that until recently when he further tested.
You try to say that you he's unprofessional doctor who saw my father that time.
No, I did not say that. So what I intend to say that, so, I think the person that first saw probably out of, I don't know because I wasn't there, was not, he didn't really, the diagnosis did not really occur to him. And thank God we have to do subsequent imaging study, and further sample was collected and it was sent to the lab, and we will now come to the rightful, the true diagnosis of the picture. I think it is an error, like I said, which I'm not trying to vindicate. Probably I'm not trying to cover up my colleague, but what I'm trying to say is that it's an error, and I'll assure you that
Are you
we
watching what you are saying? Are you
yeah,
watching what you are saying? Are you listening to yourself? Do you want to tell me that my father just ignored? We are trusting you, people. We are trusting you. This is our lives. And at the end of the day, you want to say that one of your colleague is not qualified, that he is not recognized. My father has a mass or cancer, whatever. What you are saying uh, is not recognized, and now you wanted me to move forward.
yeah, I quite imagine what you are passing through, but I'm going to assure you that I'm here with you. I will ensure that you get your justice. I will ensure that you follow this matter to the end, and you are satisfied with all that comes after the matter. But I want to assure you that we have raised the incident reports concerning that, and the concerning the doctor that did that. We've started the process, and we are showing you that we'll get to the roots of it, and you similar thing will not reoccur in the future.
Okay,
How do you
so
feel about that?
can you give me the name of this doctor? I really need to raise a complaint.
Yeah, like I said, I'm going to be with you throughout, through the rest of the process. But I want to assure you that currently, I personally do not know the name of the doctor. But like I said, the incident report has already been, raised, and the team that are in charge of it have already started their investigation. But not to worry. I believe the team that are going to investigating the matter will do justice to it. I must assure you about it. Are you okay with it?
No, I'm not okay. I'm not okay at all. My
Okay.
father is dying now. Do you know? My father is dying. Now he has cancer, and this cancer is already gone beyond his lung. And now you are telling me, don't worry, just because of a mistake.
Um,
I will complain. Can you tell me how I can complain?
like I said, we are with you. We are with you totally, fully in this condition that we are passing through. I think what is of paramount important to us is the health of your father, and it has gone really. It is saddening to tell you about his condition. This cancer that he's having is a cancer that has involved so many parts of the body. It has spread to involve so many parts of the body, and currently we'll work through with you to inform, work through with him, and we are informing you that your father may be benefiting, may need to benefit from certain care in which if you give me the chance, I'm going to tell you about certain care that your father will need. But by the way, I want to assure you that for that doctor that did that, we ensure that you get your justice. And if you really need to push forward, there's what they call the PALS, which is the Patient Advisory Liaison Service, that I want to introduce you to them so you can file your case there and they will help you to get justice. Is that okay?
Yeah. I think I will go for that. So what you are telling now, the next step?
Okay. Concerning your dad, like you said, your dad has cancer, like you already know. So our next step in terms of is the plan on how to manage him,
2
because of the
minutes
fact that
left.
it has spread to other parts of his body. We need to consider what they call the palliative treatment for your dad, because so that we can at this point that he is now, we need to just be managing symptomatically. Whenever he has any complaint, if he's pain, we manage the pain. If he's if he has low blood in the body, we need to transfuse and probably give him some other medication and then some chemotherapy if need be. And I don't know if you're okay with that.
I don't know. I'm just all over. I'm all over. You are just killing my father and then just palliate him, just to let him die in peace. I'm really.
I'm so sorry.
I can't trust you. I can't trust you anymore. I can't keep him in this hospital. Can you refer me to other hospital? I can't keep my father here.
Okay. I quite understand that if you really, if you want to refer, I will definitely consult with my consultant, and we ensure you have a peaceful transition to whatever hospital you please. But if you really need my own advice, I also want to kind of advise that whatever thing that he will be, whatever treatment that he will receive in another hospital, we can also provide that here. But if you feel that your father wants to go to the next hospital, we'll be happy to work with you in that direction, and we ensure a peaceful transition. Is that okay?
Yeah. I just want to be in another hospital. I'm not trusting you people. I don't trust you.
It's okay. But, all right. I will talk to my consultant and inform him concerning your decision, and I will ensure that you meet with the PALS and get your justice. How about that?
Yeah. I'm going for that.
Are you feel much better now?
No, I'm not feeling better. I'm just need my justice, as you said. I will go to the PLS and I'll see
Okay.
how things going. And can you give me the name of that doctor, please?
And like I said, I don't have the name, and but like I said, we have a team has been set up to investigating that issue. I don't know the doctor, and once we get to the part, I believe that they will.
You are covering your colleague. What I understand, you are covering your colleague.
No, like I said, I'll be with you to the end of it. I will ensure that you get what the justice that you're looking for. That is why if I know this name, definitely I'm not in the best interest to give it to you, but definitely we ensure that the right person, you follow the right way, in which the first thing, like you said, to go to the PALS, while we as the team, we set off the investigation incident report and we'll continue to investigate the matter until that has been sorted. Is that okay?
Oh,
Okay.
All
yeah.
right, thank you. Okay.
Okay. Thank you. Time is up already. 1 minute also pass extra.
All
Thank
right.
you, Dr. Henry. Well done. Let's know what's defecting in this scenario and you didn't cover. Dr. Maida now will comment, then I will comment.
Okay. So you'll try to deal. Well, I think you did your best. The only comments I felt blaming. So in this scenario, we try to not blame others. You blame your colleague, and this is, I think, a very big mistake in our clinical scenarios. We can't blame others because we are a team. We we say yes, there is a mistake happened, we are responsible about it, not another team, not another, you don't give like another people, another doctor, someone else, I don't know what happened at that time. We have clear, we know when you came to discuss with this patient, you know that the X-ray hasn't been reviewed, mistakenly haven't been reviewed, and this is a team mistake, not a system. And I prefer not team either. If you say a system failure, so it will be more like you give something broad for the patient, but at the same time you are you say that we have mistake, we did a mistake, but this is a system failure, because X-ray not reviewed that there is many people in this cascade of work, the radiologist or the photographer who take the the X-ray, then the house officer or whatever who see the patient, and then the nurse who sees there is a cascade of people doing this job. So we need to make say like generally system failure. uh, the good thing that you address he's very angry patient, so you try to be calm. I think you need just to make be empathy, more empathic with this patient, because it's really difficult scenario that to seek medical advice and at the end ended by um, mistake like this. And you tell the incidents report, and if you said that this is very highly this is a very we report this in a very serious incidents report, that means all the hospital is aware about this, and this is like ringing a bell in the hospital. This is very serious report. It must not happen to your father and not no one else. This is very serious incidents report, and it's not accepted at all. So try to make this patient that understand how serious this issue has been taken by the hospital and by the team. The third thing that I think the management plan, you go through the management plan what will happen, but I felt like if you try first just to tell this patient there is no go around it, but at the end of the day, if you give him, do you want another meeting to discuss the management plan, understand if this son is ready to understand what is the next step, just give him like a shot that uh, are you ready to move forward to do whatever. And regarding the trans to transfer the patient, I think you address that, but I think it is not your duty that to make this transfer. And at the same time, you can give because yeah, I think you give this son that we will transfer him to another hospital, and we ensure that it is safe transfer and everything. And this is not your job, and it's not your duty. And the other, you don't know which other hospital, but instead if you said that we will try to give him the best care he had, and if you want, so it will be like self-discharge or something like that from side of the patient family. So we are as a hospital, we will not refer to another hospital unless that's needed. Okay.
Okay.
Yeah, thank you, Dr. Maida. Well done. The clarification. But I will add to the last point. It's not only his duty, it's also his father decision. Here, no mention about the capacity of the father. So as long as the father is okay, he can decide. He is the one who will be deciding which hospital he will receive his management. So if he's insisting, of course you have to convince him that nothing will be changed from this hospital to other or to another. Adding to this, your father is awake enough, he can decide, he share with us, with you, if you want to sit with him and to tell us about his wish. Okay, this is regarding the last concern, which is transfer to other hospital. Let's start from the introduction. I advise you, Dr. Henry, whenever you are entering the station, you have to know the patient name, the patient age. Okay, you can ask about the son, what's your name? But you are talking about the patient himself, not about Mr. Ahmed. So you are Mr. Ahmed, you are the son of Mr. Imran. He is 60 years old, yes. This is the first thing. The second thing, are you the next of kin, not lasting power of attorney? Okay, so you cannot say you are the lasting power of attorney. He doesn't know what is the lasting power of attorney, but he knows that he is the next of kin. Okay. The third point, you cannot invite someone to attend to hear about his father news because his father is still awake and he's able to understand and to decide, right? Nothing mentioned here that he lost the capacity. So you cannot invite someone with the son to hear about his father condition. If you want to do, you can assume that you get a consent or a permission from the father to talk about his condition, not from the son. Okay, not the son here is the next of kin, so he can discuss with you without consent. But you have to get a permission or the consent from the father to talk with his son. Clear? So he can ask you, but you cannot talk about his condition without the father permission. So this is the introduction. The background. Can you tell me how is your father? How the expectation about what's ongoing? He will be angry, of course, because there is a mistake. Okay, so there is a mistake, and honestly, you will say from the beginning we had a mistake. Sorry, it was missed reading by our physician or our colleague or our doctor. However, we take this seriously. We will react with this. We raise an serious insert report, as Dr. Maida mentioned, and follow the steps of medical error. Okay, consultants meeting and root cause analysis, why it happened, but be sure that it wasn't intentionally. We used to read every X-ray or every photo or every scan after finishing the scan. In your further condition, exactly with there is an error happened, maybe system failures, but don't say I wasn't there. Okay, it's very irritating to the examiner when you mention I wasn't there. Means that you are trying to get out of the responsibility. No, it's your responsibility now. You are the one sitting with the son or the next of kin. So you have to address the concern and you can say, we will investigate that. We will know what exactly happened with the father and the scan and why it wasn't read. Okay, so, and it was unintentionally. We used to do so and so on. The next thing, do you think, Dr. Henry, within the few weeks the cancer spread? Do you think so?
Um, Probably it spread have started ab initio before the few weeks. Is
Exactly, yeah.
yeah.
So you can even use it as evidence wise, theoretically, whenever there is a cancer and spread means it was there, yes, we miss it. But his condition was probably already spread not within the few weeks, no, I think before that. So just to be aware about this point and to defend the medical team decision about the father decision, even he will not benefit from anything if we discover it earlier. What do you think, Dr. Maida? Because it's written here, it's few weeks.
Few,
It's
4 months, few weeks
no,
for
no, it's
even
few weeks.
even few weeks. I think yeah, it's not make a difference, but also it will be irritating for the patient.
Yeah, exactly.
But
So it's
try like you will try to say even if we do that, it will not affect his.
yes, exactly.
So it's irritating him. Just we try to be. There is a mistake. We agree that there is a mistake. There is a
Yeah, there is, of course. I
system failure. We need to investigate that. We
yeah,
are upset about what happened and everything. So we'll try to mean this.
absolutely right about this. Yes, you are right about this. By the way, If they want to make it a clear mistake about delay diagnosis, it would be, for example, 6 months or more. But in this scenario, it doesn't matter, within few weeks, but the mistake still mistake and the error is still there. He didn't read it. However, it will not change the management plan. Why? Because it's already spread. Okay, so these are the concern related to the discovery of the mistake, how to address it, and how to deal and with the angry person. The next thing is, after that, what you will do? I want to complain. Okay, you can complain. I will guide you to the pulse office. I want the name of the doctor. Don't tell him, yeah, if I know, I will tell. No, it's like you are helping him to attack this person. So how to deal with it? We are here as a medical. So as Dr. Maida said, don't blame others. So don't show him that he is mistakenly did that. Yeah, there is a mistake, but you don't know what happened exactly. So we will investigate. And if you need the name, I'm so sorry, I cannot give you a name of a doctor. However, there is what's called Pulse Office. I will refer you and I will guide you to them. You can raise your complaint there, and everything will not affect the further care. Okay, try to reassure him that everything will be provided to his father. Sorry, regarding his full care and management plan. This is the third or fourth concern. The last concern which you covered and you touch, which is very well in this scenario, you touch the palliative. At least mention the palliative as a word. Palliative therapy, some exams and some examiners, if you didn't mention the palliative per se, they might minus you. Even you will talk about the palliative in details. Here, in this scenario, you have to say your father will be managed as called palliative management or palliative therapy or palliative treatment. What is that, doctor? Now you can speak about the symptoms relief, as you said. So we will treat his symptom. We'll be sure that he doesn't have any pain or infection or anything can affect his quality of life. This is the meaning of palliative treatment. So you have to mention the name, the management plan is palliative, and what are the items of the palliative therapy. You can ask at the end about his social, with whom he's living, does he need any support or anyone dependent on your father. Definitely in this scenario, if you have time, you can read the issue of advance directive. Did your father wish or write any document about his wishes in the future, how to be managed, or anyone to be nominated to take decision on behalf of him if you have time. But with the angry person, I don't think you can cover all the things, particularly this scenario with where they mention the management plan, the mistake, and explanation about the finding. I hope it's clear, Dr. Henry.
Yes, yes. Thank you very
Okay,
much. It's
most
clear.
welcome. I think it was a good scenario from Dr. Maida. It covered a lot of things, how to deal with the angry, plus the mistake, how to deal and handle the mistake from your colleague, plus the palliative and the social, as well as lasting power of attorney advance directive in such scenario. Any point to be raised, Dr. Maida, we missed? Any
And I think,
suggestions?
yeah, we
Yeah,
raised most of the issues.
okay. Yeah, the transfer already I mentioned earlier. So he will ask you about transfer, but or transportation, but it's again, you can convince him by two ways. Uh, if he insists, you can say the father can share with us his decision, but before that, we no difference or no change in his plan from hospital to hospital. No, I want to take him. Okay, let's sit with your father, and let's see what his decision. Okay. This is the way about all the concerns related to this scenario. Anyone with question? Dr. Maida first and Dr. Henry. Everything
Yeah,
is clear
uh,
and
yeah.
yeah,
I just have some few questions.
yeah,
Sorry.
sure, sure.
The thing is that the patient is already angry.
Mm-hmm.
I don't want to further aggravate his anger
Yeah.
by denying his request about transferring his father. I know that definitely since he has gotten his father's consent to discuss with me, that was why. But I think you both of you have shed more light why I needed to tell him that until the father has to be done to make that decision to be transferred. Initially,
Yes.
I was thinking towards that line, but
N-
because he was already angry, I did not want
no.
to further
Yes.
aggravate his
Yeah.
anger.
Yeah. I
And
got your question,
yeah,
but in basis wise, they want you to deal with the thing correctly,
yeah, that's true.
not emotionally. You want to
Yeah,
react with him emotionally. Yes, you can take your father. No, in basis wise, if you said take your father and you can go any hospital, you did wrong, of course. Why? Because his father didn't decide for that,
so
right?
yes, that's
And
true.
you didn't
That's
try
true.
to convince him. Even he's angry. What's the problem? You have to deal with the concept, either angry or calm patient or person correctly, not according to his emotions. Okay?
Yeah, yeah,
Clear now?
yeah, clear, clear.
Okay. Any other question, Dr. Henry?
Initially the question, the scenario was too much. So I was trying to, and couple with the background fear that was
Yeah.
created by you and and her. So I kind of trying to balance the name. That was why probably I flopped in terms of the name. I couldn't picture the name clearly, and
Yeah, it's okay. By
yeah,
the way,
but yeah, I think I've
y- yeah,
I've,
sorry
I've
to
learned.
interrupt you, but
Mm,
why I mentioned that just to learn from the mistakes.
yeah,
Okay. And
yeah,
by the way, in the exam, believe me, you will forget the patient name, the surrogate name, the age, maybe even you forget your name. Really. So you will
yeah,
introduce yourself or you will not introduce yourself starting immediately with the patient. So just train how to deal with the introduction.
yeah, yeah,
With the practice, you will be more professional. Okay.
yeah. Thank you. Thank you.
Most welcome, Dr. Hina. Any other question or
No, no,
suggestion?
no,
Okay.
no.
Thank you, Dr. Henry. Thank you, Dr. Henry and
Welcome.
Dr. Maida. Particularly, anyone with question apart from participants? Any raised issue, suggestion? Feel free to comment verbally or written. Okay, it's clear for all, satisfied all. Now the time to wish you happy and nice weekend. See you inshallah after the weekend. Good luck and good night. Assalamu alaikum wa
Mm,
rahmatullahi wa barakatuh.
Thank you so much.
Thank you. Thank you.